Hello, good afternoon to all, but also good morning and good evening to many of us. It is really our pleasure to welcome you to our first webinar in a new series of ITM alumni webinars featuring the ITM winners of the Prize for Global Research 2023. The Prize for Global Research is awarded yearly by the Province of Antwerp to research projects of master after master students of ITM and other higher education institutes. Development relevance, quality, and originality of the master thesis are key in the selection. Through these awards, the Province of Antwerp wants to stimulate global research. In the first webinar, MPH alumnus and laureate Hashim Hounkpatin from Benin will share insights from his master thesis entitled "How are health systems in sub-Saharan Africa adapting to protect human health from climate change threats?" The main aim of this webinar series is to share research findings, expertise, and experiences on a specific topic within the ITM community of alumni, students, staff, partner institutions, and the wider global health community. I will now explain briefly the practicalities of this webinar. If you want to ask a question, you can use the Q&A option you will have below your screen. If you want to ask a question in live, you can also raise your hands, also below your screen next to the Q&A box. The chat is being disabled for questions. Questions will be moderated and only a select number of questions can be answered in live given the limited time. Unanswered questions cannot be answered individually afterwards, for which we apologize. You can, however, use also the forum function in the online alumni platform to start a discussion on your questions left after the webinar. At the end of this webinar, a short survey will be displayed and a browser window will open to give your feedback. The webinar is being recorded and will be made available afterwards as well on the ITM alumni platform. Our today's moderator is Bruno Machel, MPH Director and Head of the Complexity and Health Systems Unit at ITM Antwerp, Belgium. Bruno joined the Department of Public Health already a couple of years ago, and he's professor and head, like I said, of the new unit Complexity and Health Systems, and the director of the Master in Public Health, together with the co-director, in fact, together with Tine Verdonk. He mainly works on strategic management of healthcare organizations and stewardship, resilience, urban health, and research methodologies for complex issues in health. Bruno, please, the floor is yours.
Thank you, Charlotte. And in fact, I'm quite happy to be able to introduce very shortly and very briefly Hashim, who was one of our MPH students last year. And as Charlotte already indicated, he did a very nice thesis, in fact, that made him win the prize of the province. Hashim is a staff member of the Centre de Recherche en Reproduction et en Démographie, that is CERUT, in Cotonou, Benin. He trained as a medical doctor, but has been doing quite some research in the last 7-8 years on maternal health, universal health coverage, health system strengthening in general. So today we'll present the main themes of his thesis, which is quite topical, if you want, or even in fact quite urgent in the sense that he's tackling climate change. So Hashim, the floor is yours.
Thank you very much, Bruno. Is my screen visible? Yeah, okay.
Yes, it is.
Dear participants, thank you for joining this conversation. The image you are seeing on your screen is not a flooding. It is a village lake, a lake village, probably the largest in Africa, located in Benin, and that's home for up to 20,000 people. From the makeshift houses and the heavy reliance of people living there on their physical environment, we can imagine how some population group are naked in face of environmental degradation. And when we consider that climate change is the single greatest threat to human health in the 21st century, it is interesting to explore how health systems in sub-Saharan Africa are adapting to protect human health from climate change threats. So let's start with climate change definition. So climate change refers to the long-term shift in weather patterns, and it affects all dimensions of health, either directly or through the social and ecological system. Though sub-Saharan Africa participated little to the climate crisis, it stands out disproportionately as one of the most affected regions. The temperature increase in sub-Saharan Africa is greater than the global average. Extreme weather events is affecting tens of millions of people with food insecurity, displacement, and migration. And change in vector ecology has extended malaria transmission season by 2 weeks. The health impact of climate change is anticipated to only worsen, and adaptation is therefore unavoidable. Benin is one of the most vulnerable countries to climate change. It manifests through the frequency and magnitude of extreme weather events. And as an example, the country experienced in 2010 a flooding, an historical flooding that covers 2/3 of its territory. To lessen its vulnerability, the country developed last year its National Adaptation Plan, prioritizing 8 sectors, among which the health sector. But to understand how countries are really adapting to climate change on the continent is challenging, as the climate and health literature is dominated by impact studies. And that's the reason why I undertook this study with the aim of contributing to the understanding of how health systems in sub-Saharan Africa are adapting to protect human health from climate change threats. To achieve that, I reviewed the literature on adaptation measures, analyzed the Benin adaptation policy making process, and finally formulated recommendations. I used a multi-method study design combining a scoping review with a case study. With the scoping review, the scoping review provided an overview of adaptation measures in sub-Saharan Africa, and the case study provided an in-depth account of the policy-making process that leads to those measures. Let's zoom in each of the methodology. So first, the scoping review followed steps proposed by Axe and O'Malley and adapted by Levac and colleagues. So adaptation measures were extracted from selected studies. So the studies were selected within 3 databases, and the measures were later organized within categories. For the case study, I defined the case as the adaptation measures in the health sector in Benin, and the unit of analysis is the health component of the National Adaptation Plan. The National Adaptation Plan served, therefore, as the main data source, but complemented with reports and institutional websites. The health policy triangle was adapted to analyze the policy document. Now that we have described the methodology, let's look at the findings. A first finding here is that the climate change and health literature in sub-Saharan Africa is slim and juvenile, and is dominated by authors mainly from Europe and South Africa. A second takeaway from the finding is that countries on the continent are adapting through actions within 7 domains, namely health system strengthenings, policy and planning, financing and implementation, information and capacity building, citizens and migrants resilience, disaster prevention, preparedness, response and recovery, and finally, mitigation co-benefits. So mitigation per se is not an adaptation action, but it has health co-benefits that were relevant enough to include them within the adaptation tools. To understand how countries on the continent end up within those domains, let's look at the Benin case study. So Benin is a coastal country in West Africa, and the country have signed dozens of international climate conventions and has national policy instruments that are favorable for adaptation policy making. On content, so first we will see the hazards. So the country prioritized 3 climate hazards, namely heat waves, flooding, and drought. And they identified health risks associated with those hazards. But what's interesting is that mainly the physical dimension of health was considered and less included in the policy documents. Another takeaway is that the adaptation categories within the document overlap with the one that we have seen, the 7 that we have seen in the sub-Saharan Africa region. So on actors now, the German Ministry of Environment commissioned its International Cooperation Agency, GIZ, to support Benin in its adaptation policy making. So GIZ commissioned climate analytics and CPED for technical support, and additional funding was provided by Green Climate Fund and United Nations Development Program. At the national level, the government of Benin hold the agency and leadership in the policy making process, and the parliament was involved for legislation development. So key aspects. So this is a summary of the National Adaptation Plan policy making process. It started in 2013 and took 10 years to be finalized. 3 events to pay attention to include, first, these health sector vulnerability and adaptation assessment studies. So the study was has informed the National Adaptation Plan, so it was a baseline study. But what was interesting here when I was doing this research was that the vulnerability and adaptation assessment only focused on 1 health district out of the 34 of the country. It only focused on 1 disease, which is malaria, and it lasts 6 months. So you can understand that there was an urgency to have this sectoral adaptation, vulnerability and adaptation assessment study ready, so that the National Adaptation Plan can be ready within a certain agenda. Sorry. So the second point to pay attention to is this methodological guide for climate change integration in policies. And this guide supported the health, climate, and health in all policy, climate in all policy agenda approach. And finally, the National Adaptation Plan was released in 2022, last year, and it covered the time frame until 2030. So let's discuss those findings in depth. looking at each domain that we have listed before. So on health system strengthening, health systems in sub-Saharan Africa have been weakened by decades of underinvestment, structural adjustment plan, workforce drain, and technology dependency. They are currently using tools such as the WHO framework for building climate resilient health systems to strengthen their health systems. Second, as we have seen in Benin, countries in sub-Saharan Africa are mainstreaming climate and health as policy action, and policy is at advanced development on the continent, mainly because it is an umbrella for other domains. But the dominant role of international actors, as we have seen in the Benin case, is leading to policy mimicry across the continent, especially in a context where regional and subnational levels are overlooked. Financing is the main barrier for climate action. And in sub-Saharan Africa, a lot of countries, most of the countries rely on international funding, both for pragmatic and climate justice reasons. They are also advocating for cancellation of historical debt and reform in international trade so that it's less predatory. We know that information is a leverage point in every system, but the data paucity in adaptation, especially in health systems adaptation, is alarming. But some countries such as Nigeria and Lesotho are using early warning system to communicate risk to their population and cascade and building capacity to cascade adaptation actions through sectors. Countries are also increasing their citizens' resilience, citizens and migrant resilience through education. An example is in Rwanda and Malawi, where the government is educating the population on heat management and vector breeding sites removal. Countries are also investing on social protection to address structural determinants of inequality and vulnerability. But climate events such as drastic shrinkage of Lake Chad are generating mass migration. Migrants at their destination are facing challenges in accessing the health sector. And an example is Zimbabweans in Botswana and South Africa that cannot access health systems because of fear of deportation and poor providers' attitudes. Before disaster hits, countries like Sierra Leone are investing in climate-proof infrastructure. And an example is in Sierra Leone, where they are leveling up infrastructures to make them flood-proof. During disaster, as we have seen during cyclones in Mozambique, humanitarian aid flows, and there is a lot of attention and action within the country. But after the onset of the crisis, of the disaster, the people, the population, and the country are left alone, and the people and the country hardly recover for a disaster, especially when they are as high in magnitude as the cyclone that we have seen in Mozambique. Finally, countries are also adapting, as we have seen, through mitigation actions. But there, in Africa, millions of households still rely on dirty energy for cooking and cleaning. That's leading to indoor pollution and millions of premature deaths, especially within women and children. And though a global fossil fuel phase out is expected, countries in sub-Saharan Africa are arguing that they still need fossil fuel to ensure development and alleviate suffering. We have ventures some adaptation scenarios in terms of outcome within the continent. So depending on how adaptation is conducted, it can be good, it can be bad, and it can be ugly. The ugly adaptation is seen all symmetries are both roots and symptoms of the ugly adaptation. So we first have the asymmetry in contribution to the climate crisis. We have asymmetry in impact, asymmetry in adaptative capacities, and asymmetry in power to decide. So when the adaptation process is selfish and selective, it generates ugly adaptation, and that was seen during COVID-19, where Global North has excess stock of face masks and vaccine, and they were not willing to share it with other populations. The bad adaptation outcome, the bad scenario, is typically the top-down bureaucratic approach, whereby theory, money, and frameworks are thrown to problems. It can also be the side effect of a good adaptation. And when we look at the use of air conditioning, we can use it as a good example. So basically, when we have a heat wave, a good reaction will be to turn on the air condition. Rightly so, because it helps, it decreases heat stress and physical impacts of heat. But in the same time, at the same time, it contributes to the climate crisis. It contributes to it exacerbates the heat, outdoor heat, and those who are outdoor and most of the time who cannot afford to have air condition are the most affected. And air conditioning also contributes to the climate crisis by generating greenhouse gas emission. And lastly, it contributes to poverty. Actions that are also taken in the name of adaptation and that result in waste of resources can also label as bad adaptation. Finally, the goods, what we can label as the good adaptation is the adaptation that is embedded in positive values and principles, not forgetting that the root cause of the current climate crisis is human, it's human-made, and we can only sustainably solve the crisis when we consider the values and principles, the positive values and principles that can help shift the current trends. We are also in a matter of emergency in terms of actions, but in terms of appropriate actions. So actions that are appropriate and are timely also can contribute to the good scenario, good outcome of adaptation, especially when it takes into account the systemic impact of every action. This study has some limitation. The first one is that the scoping review was performed by one reviewer. The single case study has limited robustness, and the actors within the Benin case study were less explored. However, the use of multi-methods provided an in-depth insight of adaptation in health adaptation on the continent. The use of the policy triangle supports the exploration of adaptation policy making through the interplay of the 4 domains: context, content, actors, and process. And finally, during the process of this research, I had interactive discussions with my supervisors that have helped triangulate and challenge support ideas. As a way forward, I can suggest to policymakers to build multi-level governance that goes beyond the current global country the global country that just go beyond the global level and country level relationship, and that integrates the regional, the sub-regional level and the sub-national level. It's also important to balance top-down approaches with bottom-up approaches, and that way we can ensure that we tap into the potential of citizens and their contribution in the adaptation efforts. We have seen that funding is the main reason for climate adaptation inaction, and the increasing funding is therefore important increasing funding is therefore important to make sure that adaptation has good outcome. It is also important to improve research in sub-Saharan Africa, and finally approach adaptation in a systematic and transformative way. I strongly believe that the climate crisis is also a health crisis, and we can see in the upcoming COP28, a whole day is dedicated for the health, and this is the first time this is happening. So health systems need to stretch their sphere of influence to health determining sectors. Thank you very much for your attention. I'm looking forward to having extended discussion with you.
Thank you very much, Hashim, for your nice presentation, quite concise and well structured. I will start channeling some of the questions which have been raised through the Q&A function in the chat function. In fact, I'd like to encourage the public to ask questions so that we can have, in fact, a good debate. The first one is very much a methodological question. And someone, in fact, I'm not sure who, it's an anonymous attendee who asked the question: how did conducting a scoping review on your topic influence your policy analysis process? Were these two done at the same time and put together to form your thesis? So was the relationship between the scoping review on one side and your actual case study of the Benin policymaking process?
The relationship between the case study and the scoping review.
Yes.
Is it that the question? Okay. So I think that this slide can help us answer the question. So I first did the scoping review to have an overview of everything that's happening in terms of adaptation on the continent, the adaptation measures. So the scoping review helped to provide an overview of adaptation measures on the continent. And then the case study provided and the how those adaptation measures are generated within countries. So one thing maybe to mention here is that this study focused on adaptation from state actors and not from other actors such as the private sector or the population.
All right. And perhaps kind of a follow-up question to that.
Yeah.
So there's a question, another question, but I'll do a follow-up question basically. How good was the evidence that you found, in fact, of adaptation and mitigation plans in the whole of the African health sectors or the health systems of the African countries? And do you feel that in general, Benin is in a kind of a similar position compared to your neighboring countries who are more or less dealing with the same issues?
So thank you for that question. Most of the countries are still at an early stage in the adaptation action for the reasons that we have already mentioned, the lack of resources, both financial but also technical reason, and they are only now putting adaptation on the country's agenda. So for Benin, for instance, the implementation of the National Adaptation Plan, the implementation phase is still to come. But generally, we cannot just close adaptation within a box, and countries are doing different actions, even if they are not labeled adaptation, that are contributing to adaptation and that could even be labeled adaptation. So yeah, that's what I can answer. Yeah.
Okay, I need to unmute, of course. There was a question from Stephen, who you know quite well, who also, in fact, last year focused his thesis on the climate adaptation strategies of one of your neighboring countries, Cameroon. So the question of Stephen is perhaps, again, twofold. One, how comprehensive is citizen and migrant resilience, or trying to increase, in fact, citizen and migrant resilience as an adaptation measure in not only Benin, but the whole of sub-Saharan Africa? Is it being talked about, and are the policies focusing on strengthening individual resilience of people and migrants?
Thank you very much, Stephen, for the question. So citizens and migrant resilience on the continent, it is a hot potato, especially when it's come to migrants. But one thing to say here is that there is a lot of, from this perspective, the state actors' perspective, there is a lot of top-down approach and actions that most of the time do not translate in actual reality at operational level, at people level. And the category, this domain, especially migrant, was put there on purpose to shed light on their existence, because most of the time we forget about them, especially when it comes to social protection and reduced vulnerability. So actions are taken within countries, but they are still not well documented, and probably not as strong as they should be.
Okay. We'll come back to the policy implementation gap perhaps later on, because I'm seeing some questions that are related to that. But the second part of Stephen's question was, what about communities? Communities as an actor in shaping policies and in shaping implementation.
Yeah.
And related to that, the question of Césaire Hounkpatin, who is looking at awareness about climate change and health problems. And I would say at community level, how do people on the street actually think about climate change? Is it an issue to them? And second, if so, are they actually being heard by policymakers in Benin?
Okay. So I am sure there is no one answer to that question, but what I can venture here is that the framing of climate change may not talk to a lot of people. Using that terminology, we will not talk to a lot of people, but sure, farmers can farmers, but not only farmers. People are witnessing the variability of weather. In Benin, for instance, we have within a year 2 dry seasons and 2 rainy seasons, and they used to be very reliable, but for since a few years now, everyone is noticing and talking about it that they are less reliable, and farmers are complaining about their crops and them not being able to rely on weather. So people are experiencing it that way, but not the climate literacy is still very low. Mm-hmm. And attribution also beyond crops. The discourse is very dominant within the farming agriculture, but beyond agriculture, in the health sector, for instance, it's less discussed. And I am sure that there is a lot to do in terms of climate and health literacy.
Yeah. So your analysis to some extent is that, okay, people are concerned by the direct impact of climate change on their daily lives, but are not so much, let's say, activated or mobilizing into community groups or even movements, perhaps, to press for change?
Sorry, Bruno, what's the question?
So if I continue a bit on your line of thinking, in the sense that you say the people are in fact being confronted with the direct impact of climate change, farmers, people who suffer from flooding and extreme weather, but that they don't generally yet mobilize for climate change, that they don't form movements or protests, demonstrations to put the policymakers under pressure. That is not yet happening in Benin, I think.
Been frozen from my side. Can you the last part, just the question?
So okay, I'll rephrase it a bit and go into some of the other questions in a sense.
Yeah.
One thing is to have good policies and kind of sound adaptation measures. You already hinted to the policy implementation gap, where these policies have to be implemented, but there's lack of funding. That's one, and that's what you mentioned at the end. But is there pressure from people on the street actually to push the policymakers for more direct action, for more increased funding to do something about it?
Thank you. So you know that in most of Sub-Saharan Africa, basic needs are still to be ensured to the population. So they still have struggle with basic education, basic healthcare, etc. So I'm not sure that at least we are not seeing people on the streets fighting for climate adaptation action, whatever the sector is, even in the agricultural sector, where the climate change impact is mostly felt. So I was talking of the literacy. If you even within the health providers, coming to the health sector, climate change is not really an issue yet. I'm a medical doctor. I discuss with my colleagues, and some of them are online now. So it's not still, and even in medical school till now is not taught and is not within the debate within the sector. And I don't know how it is in other countries. Maybe if the participants have experience, they can share it in the chat. Thank you.
Yeah. So, okay, another question that goes more or less in the same kind of way, in a sense of why, and I think a lot of the, so I'll say it in a different way. I think what you see in Belgium and in Europe in general is that, okay, we are aware that something should change. There's a lot of talk about it, but the actual actions are often delayed, and politicians seem to be very resistant to really impose drastic changes. And you saw that recently in the United Kingdom, where the Prime Minister really scaled down the ambitions for climate change adaptation dramatically, probably because he thinks he might get some political gain out of that. The same direction goes, and in the same direction goes the question of Marijke Sijsens, who says, okay, you mentioned that sub-Saharan African countries are not up to the phasing out of fossil fuels because they argue they need it for the development of their country at this stage. Do you think that's a valid argument? And is fossil fuel the only way, in fact, through which countries like yours could move on into developing their societies and economies and health sectors?
So that is a tricky question. Maybe I can reformulate it, putting myself in the shoes of a leader who really care about its population. So I know that I can use fossil fuel, and basically fossil fuel is everywhere. Even we're discussing it today. Even in the net that we use, the mosquito net it's there. The gloves that we use at hospital, it's there. The car that we use to go, it's everywhere. Actually, our life is based on fossil fuel. It's everywhere, everywhere. Even the computer that we are using, there is plastic there and fossil fuel behind it. So it's everywhere. And as a leader caring for
Hashim, we seem to lose you.
Yes, indeed. Maybe he should also stop screening, might be a solution. Sharing the screen, I mean.
Yeah, let me see if you can. I'll send it by chat. So, okay, we're trying to figure out how Hashim can be back online. He's currently in Ghent attending a workshop on climate change, migration, and health. And it seems the connection is not very good at the center. Okay, Hashim, you're back. Can you hear us, Hashim? Can you hear us?
Hashim, maybe you should stop sharing your screen. That might better or lighten the the connection.
And your microphone is also muted still. All right.
Bruno, can you hear me?
Yes, you're back.
Okay, sorry. Yeah.
So
Yeah.
let's continue, please.
I was saying that it's not a yes or no or a bad or wrong, but I think that it's within the global cooperation institutions that we have. So this is a unique development on healthy of how not polluting, not destroying the environmental environment in the process. But within the global corporations institutions, there is the North and the South due to history and everything that we know. So everything that we know, that trust is not in countries in Africa.
The connection seems to fail.
As a good case study of how the global
Hashim, it seems we're losing you again. Okay, so it seems Hashim will try to reconnect. Are you back on? Yeah, Hashim, can you hear us now? Your microphone is still muted now. The connection kind of failed, so we could hear you, but very fragmented. Can we try again, perhaps, to see if it works now?
I can hear you.
Yeah, and maybe Hashim, no, don't share your screen. Maybe that would that's better for the connection also. It's not necessary anymore, the PowerPoint. Thank you.
Can you still hear us now?
Yes, I can hear you. Can you hear me?
Perhaps let me kind of wrap up, not wrap up, perhaps, but go to one of the crucial aspects of how to adapt to climate change and take difficult decisions. And that is, to a large extent, how are we going to deal with inequities, in the sense that countries like yours actually don't contribute much to the crisis, and yet they face a huge burden on long term without having much capacities, financial capacities and resource capacities necessarily so to deal with it. So how is your government looking at holding up the North accountable, or holding the North accountable for delivering on the promise that we in the North would actually help you to sort out the problems? Is it kind of a national commitment or political vision at national level to work on that at a global level?
So I'm not an insider at state level, so I can not for sure say what is in their mind at that level, but through their actions, their daily actions. For instance, in Benin, there are a lot of projects ongoing based on fossil fuel, basically. But at the same time, the government is trying to champion climate change at international level. But our feeling, or my feeling, is that the climate change is getting attention from them because of the money that they can have from it, basically. Otherwise, we don't know how to develop with alternative technology. And it's worth mentioning that even the technology we are talking about are far away from us, the alternative technologies. So it's a complex situation in which I can imagine the leaders, the country's leaders are to make choice, and most of the time it's easier to go with the old ways of doing the business as usual, using leadership fuel and go. So as I was saying, if at global level, at global cooperation level, we redefine how we relate to each other as country, as individual, I think that the key could be there. Yeah.
Now, Eva has the same question, but now focusing from the national policymakers' perspective to inside the country. And again, drawing some parallels with what's happening in Europe, is that the people who suffer most from some of the climate adaptation measures, which ask people to renovate their houses, to consume less energy, to switch to other kinds of vehicles that do not consume fossil fuels. But again, the people who are suffering most from these measures are basically the poor people, the people with lesser incomes and with less stable revenues. And so if we don't kind of deal with the inequity issues at that level, we will have major problems in Europe, I think. The same applies, I think, to countries like yours, again, in Benin. So again, policymakers feeling that they should adapt and change things in such a way that the poorest of the population will not suffer more than they already do. Is there pressure from, I don't know, again, people's movements to push back, or what could be the role for health actors actually to push back and say, look, government, you need, in fact, also here, not only in health in general, but also climate change and equity, look at the equity issues.
Thank you. So if we see the climate impact, it is quite serious. And as health professionals, we should not just stay within our health system, our traditional responsibility, societal responsibility, but also go beyond the health per se system and see how the economical system that we have now, the political system that we have at subnational, national, and international levels, how all those systems that we have, man-made social constructions, basically it's what we have now, the crisis in itself, even the inequality is a social construction. So maybe it's an opportunity, maybe the climate crisis is just an opportunity to rethink what's not working and that drive us here, and see how we can shift from that way of doing things and readapt, basically readapt as species, and as species as how in terms of how we consume at individual level, but how we relate to others as well, and how we relate to nature, to environment, to trees, to the ecosystem that is surrounding us. Yeah.
Perhaps to end, because we're kind of nearing the end of the session, Mukhtar, again, one of your colleagues from last year, asked a question saying, look, what about your review and best practices that you found in terms of adaptation from other countries? We can focus, in fact, on this more narrow question, the equity issue, but in general, can you make us hopeful about change by saying, look, I found also some interesting, relevant experiences in neighboring countries?
In Africa?
Yes.
Okay. So, yes, countries. So once again, what we have we are discussing about is adaptation from state actors' perspective. So it does not take into account other actors. So that's something to bear in mind. So it's not comprehensive, it's not the full picture. But yes, in every country's, so maybe the message here is we should not lose hope. There are a lot of positive things that are happening. And though the climate change is coming as a crisis, it has some positive externalities also that we need to bear in mind. And a lot of actions that are not labeled as adaptation, once again, are contributing to adaptation and to alleviate the suffering associated with the climate change impact. So I think that we have mentioned some examples in Rwanda in terms of education, or vector breeding sites removal, or in Nigeria where they are using early warning system to communicate risks, etc. So some actions are taken, but they are still very how do you say it?
Kind of limited.
Yeah, implemented, not comprehensive or as bold as they should be. Yeah.
All right. So a bit of hope, but yet a lot of work to be done, I think, both within countries, but also at the international scene. That includes, I think, our countries where we need to play a much more proactive role in dealing with the problems in Europe, for example, but also, of course, in our relationships with countries like yours. So thanks a lot, Hashim, for your presentation. The line was now and then kind of fragmented or kind of cutting away, but I would encourage, in fact, all participants to still address these issues in the alumni platform of ITM, where, in fact, the dialogue can continue. So back to you, Charlotte. Thank you.
Thank you.
Thank you very much to both Hashim and Bruno as well for both sharing insights and also the moderation. Sorry for the practical and the technical issues. That's part of the internet connections nowadays. I thank you also for completing the poll, which has now been launched. And I would also like to invite you already to the second webinar in this series of laureates of the Prize for Global Research with MTM alumnus Kehinde Sherafadin Okunade from Nigeria, which will take place on the 5th of October from 3 till 4 p.m. Central European Summer Time. So make sure you register and save the date. The links are being shared on the ITM alumni platform, but also different media, social media channels. So thank you for your participation and your questions, and thank you once again to Hashim and Bruno for this very insightful webinar. All the best, and see you on the 5th of October, hopefully. Thank you. Bye-bye.
Thank you.